This event is designed especially for students and early career professionals and anyone else interested in learning more about careers in global health. We'll hear from, sorry about that. We will hear from inspiring leaders about their career journeys, pathways into the field, strategies for professional growth, and how faith sustains a global health career. And we're grateful to have a well-known name in global health here to share from his experience too. So we'll also save time for your questions at the end, so please feel free to use the chat box throughout today's session. So my name is Angelica Ocasio, and I am the Digital Engagement and Content Specialist at CCIH. I will be moderating today's discussion. And we are happy to welcome 4 outstanding panelists. So Dr. Judy Asin is a registered pharmacist with expertise in drug supply chains, health systems, and pharmaceutical care. She helped develop Kenya's first national supply chain strategy and has led research on antibiotic use and antimicrobial resistance. So, as program lead at EPN, she strengthens pharmaceutical systems and antimicrobial stewardship across Africa. She also represents EPN on the WHO Civil Society. Yasmine Vaughan, MPH PMP, is the technical advisor for global health and missions at Helping Children Worldwide. With a master's in public health from the Milken Institute School of Public Health, she has over 4 years of experience advancing global health programs and ethical missions. Yasmine also hosts HCW's Optimistic Voices podcast, where she explores innovative and ethical approaches to global health and outreach. Next, we have Luke Martin, MA, who is the Program Development and Innovations Manager at Tearfund, a global Christian development and humanitarian organization. He leads efforts to explore new partnerships and innovative ways of working, focusing on private sector collaboration, interfaith networks, and creative financing models. Previously, Luke contributed to Tearfund's Transforming Masculinities initiative. And next, we have Tom Davis, MPH, who brings over 35 years of international experience in maternal and child health, nutrition, education, and social and behavioral change. He has worked with more than 35 organizations across 28 countries and is the original developer of the barrier analysis methodology, as well as the education cascade and nurturing care group models. And he currently lives and works in Spain. So we are so grateful to have each of you here with us today. And thank you for sharing your time and wisdom with our network. So let's go ahead and dive into our first question. First, I will stop sharing our slides. Right. So we'll begin by looking back at the very beginning of our career journeys. And for those in our audience who are just starting out, hearing how you took your first steps can be very encouraging. So our first question is, what were some of the very first steps you took to get into this field, and what advice would you give to those just starting their journey? So Dr. Asin, could you start us off by sharing what your early steps looked like?
Thank you so much, Angelica. And hi, everyone. As introduced, my name is Judy Asin. I'm joining you live from Nairobi, Kenya. And Thank you for that interesting question. As a pharmacist, I think I started my early career in pharmacy practice, where I started off working in the Kenya public health system, really at the low hospital level and community pharmacies. And through there, I was able to really grasp some of the gaps that were looming when it came to access and, the challenges that were there, and also how the medications are being used. And so for me, throughout my journey, I think curiosity started looming, and I started being more curious, about how um, the broader picture looks like. And when I got an opportunity to also join the ministry side, so I shifted from practice to policy as well, where I was also contributing to designing policies at the ministry. That is where I was also able to grasp the systemic now view of the health systems, and started having that interest to really venture more into health system strengthening. And so some of the critical or initial steps that I took, I was a bit more deliberate with especially some of the mentors I was looking into. I was really deliberate in terms of whichever space I'm going to, from the practice, the mentor that I've identified in that area, and then also in the policy side, I shifted to research as well before now, of course, EPN and doing project management. And so I strategically looked for mentors that really helped me, in every step that I took. And I think one of the advices as we do that is really to be practical and ready to learn, actually, and collaborate with other disciplines, because that is one of the things I really ventured when I was in the policy side. Many a times you find us health professionals, we like silo ourselves a bit. When I go somewhere, I want to look for my fellow pharmacist, but ideally you'll be shocked when you collaborate with other disciplinaries beyond the discipline that you're part of. You're going to really learn quite a lot, and that really expands your partnership and your base. So I was very keen in also developing partnerships and just trying to network more as I was moving, because it's through these networks that we develop is where you're going to see opportunities, insights, collaborations going through beyond your usual resume. And so, of course, with the global saying, your network is your net worth, I saw it really firsthand with the connections that I was able to make every step and every opportunity that I ventured in. And I think another important thing was beyond the mentorships, I also took self-directed learning quite seriously, because I think in our pre-service training, there's no really that open topic on global health. And so venturing into that particular field, I took short self-directed courses that really boosted my knowledge and giving you that global picture of of how you're supposed to really some of the models that you can actually take along with you as you do your work in that particular space. And so another advice that I will also be able to share, aside from being open to learning more disciplines and being intentional with your connections, is also allowing your faith and your values anchor your work. Because with your technical skills, yes, it's going to open doors for you in global health, but your character is going to sustain your journey. And yeah, so I think that is one of the advice I can give as well. Thank you.
Thank you so much. Yes, absolutely. Networking, mentorship, our values anchoring our work, just like you said, are so valuable. Thank you for sharing. Yasmin, how about you? What advice would you give someone taking those first steps?
When I was in college, I was on the pre-med track, and I was convinced that I was going to become a missionary doctor. And then I read Mountains Beyond Mountains. Some of you probably know the story of Paul Farmer, and it really just opened my eyes to a world beyond medicine. I was convinced that I wanted to do public health education, and I realized that it was the intersection of everything that I was passionate about, because I was doing history and biology and sociology and pre-med, and the intersection of all those things is public health. So I pursued an MPH, and I've been working at Helping Children Worldwide after interning there ever since then. So I think honestly, a lot of it is by God's grace I ended up where I am. And if I had to give advice to anyone about what they should do as they start this journey, pay attention to what you pay attention to. Explore what your interests are. Adding to what Judy said about collaborating, be a continuous learner. Pick up certifications and courses, attend conferences and events that are maybe outside of your interests. One of the most important events that I ever attended was a peace and justice conference that was being hosted at my university. Not something that I was directly working in, but it gave me a perspective that I've taken with me for the rest of my life. So you may not walk away from that event with a job, but you'll almost certainly walk away with a new perspective and a really deep understanding of the landscape and culture of that particular area or discipline. And that's really important because public health is really broad. And there's a lot of ways that you can apply your gifts and skills. So understanding a broader landscape of things is really important. The other advice I'd give is don't be discouraged if you don't get a job that isn't focused in your interest. I was very focused on HIV work, and now I do a lot of maternal and child health work and non-communicable disease. God will show you your strengths and your gifts and where you'll need to depend on him because it's outside of your gifting. Gone are the days where people, start at one job and they stay there for the rest of your life. So your career journey is not going to be linear. And it is almost certainly not going to look anything like you expected. At our office, we always joke that I just wish once God would tell me what to do, and it would be exactly what I wanted to do in the first place. So, don't be discouraged that the field that you're entering is shifting because your life is always going to be shifting and your future is in his hands.
Thank you so much, Yasmine. Absolutely. You make plans and God laughs, right? I feel like we just have to trust and push forward. Thank you so much. Luke, from your experience, what did the very beginning of your career look like?
I think just say thanks for having us. It's great to be with you. And it's in some ways it was 7 or 8 years ago. In another way it was 10 or 11 years ago, and in another way it was when I was a child and I had a dream, right? And so it's kind of difficult to say what was the beginning. Probably consistent through all of it has been two kind of train tracks, and one of them has been I've always just had a sense that I love the church, like the biggest, broadest version of the church, like people who know Jesus and love him. I've always seen that as something that is great, got its problems, but it's something that God wants to use, but has its potential as well. And also poverty. Those have been like the two key pieces in my life. And so for me, I'd really resonate with what Yasmin said about be open to trying new things and not necessarily kind of one specific absolute, it must be this area. But kind of for me, it's working out what is it that I really care about and fitting somewhere in there. And so when I was a teenager, I started volunteering with some Christian organizations that were involved with poverty. I was pretty broad, didn't mind what they did, providing it was that. Then I did a degree. I did it in social work, basically because I thought I don't know exactly what to do, but I really like the skills and the character of social workers, so I'll do that and see what happens next. And then there was an opportunity because my university discounted master's degrees, so I did one of those because I wasn't quite sure what to do next, and that was really specifically in gender and conflict. And then from there, I took a job in global volunteering and ethical volunteering, which wasn't really my passion, but it was in the broad field that I liked. And then from there, I started narrowing down a little bit into gender. And then from there, I broadened out into kind of wider program development, which looks at health, gender, conflict, poverty, kind of a much broader space. And so for me, I don't know where my first steps were, but I know that the steps that I've valued have been within those sort of guardrails there. So that's been helpful. And then probably the other illustration I found helpful. A colleague of mine shared like a Venn diagram, the three circles that overlap. And she said, if you can find something that you love and that the world needs and that somebody can pay you for, that's your golden ticket. Like that's the one you should go for. But actually, often there's not that at one time. You might have to do two of those things, but it might bring you closer to that middle piece. So yes, I'd say those are my first steps. Quite open. I'm still in that place, and yeah, so curious to see what's next as well. So yeah.
Thank you, Luke. Absolutely. It really is like a puzzle where you are slowly connecting all of those pieces as you go throughout your career, and it's ongoing. So, Tom, with your experience, what would you say to someone who's at the very start of this journey?
I think a couple things are really important. Is one is spending some time in developing countries if you don't already live in one, and learning multiple languages. Both of those are crucial. I got my start first visiting Haiti when I was helping a friend at Virginia Tech set up a summer internship program there back in 1982. Visiting Haiti helped me to know whether I thought I could thrive there. And then I got on the mailing list of a few organizations. I took a 2-year volunteer position, so that was a Venn diagram without the much of a pay at all in Haiti. But I'm so glad I did it. My parents weren't thrilled when I told them I was not going on to med school, even though I had great MCAT scores and was all set to go. I wanted to go to Haiti and ride a motorcycle and get $100 a month. I served in Haiti for 2 years, coordinating a large vaccination program in the South run by a faith-based organization. Then I went back and got my master's in public health and lived and worked in the Dominican Republic for 4 years, training community health workers, which I absolutely loved. And I've worked for about 36 organizations since then in staff and consulting roles. I would advise all of you to learn multiple languages early. So I learned Haitian Creole and Spanish during those 6 years and improved my French. And still, my B2 intermediate French makes me reluctant to take assignments in French. So I suggest that you start early with languages and really work towards fluency in multiple languages. And that's going to take probably actually living and working in a country that speaks those languages. It's really hard to do it otherwise. The study ahead of time can help, but it won't get you to that fluency. And get a mentor. Mine was Dr. Henry Perry and a few other people, Gretchen Berggren. They were really helpful as I kind of discern next steps. And so that also can help. Thanks.
Thank you, Tom. Yes, mentorship, collaboration, and being open to those new experiences are so important at this stage of our careers. Thank you for sharing. Now that we've heard about your early steps, we'll talk about what comes after those beginnings. Every field has surprises and challenges, especially when faith is at the center of global health work. So, our next question is, what surprised or challenged you the most about the faith-based global health field? So, Yasmine, would you share something that surprised you or challenged you early on?
Yeah, absolutely. And I'll say it's actually something that I think still challenges me today. So when I first, started doing this sort of work or had an interest in this, I knew it was going to be hard, and I knew there would be bad days. I just had a conversation with my pastor about my work, and he said something along the lines of, "There must be a failure sport that you play every day." And I knew that it was going to be hard, and that things were going to be challenging. But I mostly thought that the biggest challenge that I was going to face was that there wasn't enough funding to go around. There's just not enough money. It's so hard to get it. It's a challenge to align what communities need with what big funding organizations are doing, and that the core of the issue is always going to be money and trying to align resources to needs, to have success. But I think for me, the thing that surprised me the most was that the most persistent challenge is one that's really deeply human. And it's the challenge of transforming mindsets. And that's both on the hands of the organization as well as in the hands of the community. So, practitioners, people that don't live in the communities that they serve, having to constantly evaluate and examine your own assumptions and your own cultural lens that you see things through. So deconstructing paternalistic and expert knows best approaches, especially when you're coming from a place of having a degree, like a master's degree in public health. It's easy to think that you know everything. And so you have to stop seeing yourself as a person who has solutions, and be a partner. Take the philosophy of accompaniment, as Paul Farmer says. So recognizing and mitigating your own unconscious influence of cultural background and privilege to make sure that things are collaborative and locally led. And then on the other side, the challenge of communities that are facing entrenched multi-generational poverty. So generations of chronic conflict, disaster, disease, poverty. It's really profoundly difficult for people after living through that to even conceptualize a world where sustained improvement is possible. So it's not a failure of will, but it's a rational, protective skepticism almost born from disappointment. People having a survival mentality that is from a history of system failure. And so it can make it hard for people to believe that programs can change their lives and have a long-term change. So I think the hardest part is just setting aside your own cultural beliefs and being humble, and then building that trust and belief and sustained evidence that change is possible.
Thank you so much, Yasmine. It's absolutely true. Cultural competence when your work is global is everything. Listening to the voices of the people that you are working with. So I really appreciate your insights. Luke, how about in your own work? What challenges have you faced in your space?
Yeah, it's a brilliant question. I think one of the things that surprised me early days in my career in this space is just understanding the scale of faith-based involvement in health and recognizing that actually faith-based actors, Christian, Muslim, other, incredibly important for the full set of systems to be effective. I guess the other piece that goes with that is that quality is sometimes mixed, both with kind of faith-based delivery and non-faith-based delivery. But that's not necessarily a problem. It's just recognizing what contribution do different actors make. Part of the function that I have with Tearfund, and that a lot of my colleagues have, is how do we create meaningful partnerships? And rather than kind of pointing a finger and saying they're not doing a very good job at that, it's recognizing, well, what are they gifted at? What is their offer into the full set of systems, and what support or partnerships do they need? So one example for me is we work with churches and do a lot of envisioning with churches, and very often churches might do something like build a health clinic in a very rural area. It's brilliant, it's incredible. They do it with their own resources, their own kind of ideas. They plan it, they do it. It's all local community. What that community struggles to do is to recruit professional, trained nurses, doctors, midwives. That's something that actually a local community in a very rural area probably can't do. But what they can do is then advocate to their local government. And so we might provide some support to them to help them to advocate and say, we have the infrastructure, but we can't recruit the staffing. And so for us and for me personally, it's recognizing, and it's a little bit about that kind of the local knowledge. It's saying, where is there local knowledge that's already completely there? And then where might there be additional needs? And usually, in fact, almost every situation, there are local organizations that can provide that. And so by finding the right linkages, the right relationships, the right partnerships, is really, really significant. So for me, it's a piece that I find very challenging because I don't live and work in contexts like this. I don't live in a very rural, poor community. And so it is difficult for me. And so a big piece of my time is spent talking with our colleagues who are closer to those contexts. But again, a lot of those decisions, I couldn't possibly make them. And if I did, those systems wouldn't be effective, no matter how many degrees I might develop. So yes, definitely something about localization, but real big piece about partnership and saying everyone has something to offer, but let's not try and shoehorn in the wrong piece. So yeah.
Thank you, Luke. Dr. Asin, what about from your perspective in Kenya and across Africa?
Thank you so much. And I think you will see that I was really nodding when Yasmine and Luke was speaking, because some of the things I was really, really resonating with. And one of the biggest realization was how to come into play, and realizing that faith deeply, deeply, deeply shapes how the community is going to decide at the end of the day, or which health seeking behavior they're going to have. And that is one of the strong realizations I came in term with, considering I'm coming from this aspect of the medical side, the science side. And it's not just about you dealing with the patient and bringing solutions, like a push system, but whatever you're trying to do, will it be acceptable at the community at the end of the day? In global forums, you hear about access to healthcare, and access covers acceptability, accessibility of these services, affordability, but we always forget acceptability. And I came into realization that faith has a role to play in that acceptability piece. And I think we saw during COVID, when religious leaders were actually used, to be able to address vaccine hesitance in the community. So in my line of work, and working with the health facilities in the rural communities and community engagement, some of the communities that I work with, you find that people will first of all seek guidance from their pastors, priests, imams, before actually coming to the facility and hear from you as the medic. And so I started now designing interventions that will also bring the religious leaders close to us, so that we empower them as well. So not only looking at healthcare workers as advocates of whatever awareness you want to raise. I had mentioned I'm more into the antimicrobial space, so we do a lot of awareness in the community, but not leaving out these leaders in the community who have more influence, right, and trust in their community. And so having to come into play and looking at them as also very key health advocates, and forming that partnership with them, so that you can ultimately be able to achieve whatever you had planned to achieve at the community level. And so a matter of just bridging, I normally call it as a slogan, faith meets science. So you bridge the science, the data, the evidence with now the faith aspect. You're coming to a place whereby it's really heavily grounded with their faith, their values, their traditions. And so how do you, try and make sure that you merge these two, so that ultimately whatever you're bringing, your evidence-based interventions, will eventually be accepted at the community level. So I came into realization that faith actors, faith leaders are very, very important. Yes, they do not have the scientific knowledge that you have, but you cannot sidelight them. You empower them, so that ultimately they become, the health advocates. Many times your fellow peers are going to ask you, are you trying to turn them into doctors? But no, just giving them that normal basic knowledge that they can also help you also to address that particular health issue within their congregation. And it has really, really helped. So I think that is one of the realizations I've come with to dealt with in my career. Yeah.
Thank you. Absolutely. I like your point on uplifting the voices of faith leaders and recognizing their influence in their communities. Thank you so much for sharing. And Tom, what have you seen as the biggest challenges in faith-based global health over the years?
Yeah, and I'll talk some about the beginning. One thing was just how conservative some of the Christians were in Haiti. That's the first country that I served, and sometimes paternalistic as well, especially amongst missionaries, maybe less so amongst NGOs. Not all, of course, but that was an adjustment since I'm definitely not conservative. I remember being in Haiti early on. I had this panic dream when I was in this Jewish temple in the dream, and everyone was speaking Hebrew, and I stood up and introduced myself in English, and everyone gasped and started whispering. And I looked down, and my shoes were tied with strips of bacon. So it was only a dream, but it came from really feeling out of my comfort zone politically with the community there. But I learned to appreciate them and to speak boldly about social issues in particular when I thought they were out of step with the Gospels. So that was something very challenging to me in the beginning, and I think it's gotten much better. And I think with the polarization happening amongst Christians, maybe especially amongst Christians in the US and some other countries, that can be a challenge when working in faith-based organizations. And of course, it can go the other way. You may get a job with an NGO that's a lot more liberal than you, and we'll have to kind of navigate that. How do you stay true to your beliefs and still function in an environment that might be quite different from you? But don't let that stop you. I really believe that in Christian community is one of the few places in which we have a decent chance of overcoming that polarization and learning to really listen to and love each other. And it's definitely not going to happen on social media. So engage. I think it's really important. Thanks.
Thank you, Tom. It is important to remember that we are all human. We are all people. And at the core of it, we want to help others. So I really appreciate that. Thank you. We know that the work of global health is demanding and sometimes overwhelming, and staying spiritually grounded can make all the difference. So I'd love to hear how each of you maintains that grounding. And our third question is, how do you stay spiritually grounded while navigating the pressures of global health work? Luke, would you like to start us off with how you personally stay grounded?
Yeah, that's an important question. I think there is a pressure, both in Christian environments, but particularly in these environments, where all of us want to work for other people to make their lives better in whatever way that is. And that's why we do the work. There's a pressure to then put our own needs aside, which is quite confusing because it has similar language with our faith, and put others before ourselves. That's important. It's like what Jesus said to do. But my understanding of what the Bible says is not to put yourself down to a point that you can't function, or that you experience trauma that doesn't get resolved, or that our lives are meant to be full of joy at the same time. And so try and build in celebration, even if it's very difficult. And what I find is that my colleagues that are in the most difficult environments are often the best at this. They're the best at finding moments of joy, despite the fact that their context is very difficult. A colleague of mine who works for a human trafficking organization, I asked him a similar question, and he said, remember, it's God's work and not your work. This is his calling. It's what he wants to do. He's asked you to play a part of it. He's not asked you to fix the problem. He's just asked you to be faithful to your job. And so for me, I'm quite disciplined in I start in the morning and I finish pretty much every day at the same time. I don't take my work home because I could make a small bit of difference extra, but actually I know that if I go home and I rest and I see my family, I can do more tomorrow. So remember, it's not all on you. It's what God wants to do. And then pray meaningfully. If you believe in the work and you believe in Jesus, then ask him to do it. And he's going to. So.
Thank you, Luke. I really love that. Burnout is so common in these fields: social work, public health, global health, and like you said, finding those moments of joy and remembering it's God's work and leaving it at work. Thank you so much. Yasmine, what practices or habits help sustain your faith in your work?
Yeah. Thank you for asking that. Because as you said, I think this is a really important topic. I want to be honest and say that it's been an incredibly hard year. So for anyone that is on this call and is struggling to navigate the pressure, you are not alone in feeling that way. And it is not unusual to feel that way. So you should not feel guilty. You shouldn't feel bad about feeling bad or sad. I would say the things that have helped keep me spiritually grounded is that I work on a really great team that prioritizes faith. We're really honest with each other, both about our professional struggles that we're having at work, as well as our personal struggles. Our leadership team meets every week, and we outline a prayer request that we have for others to pray for. And I think that's really an important way to do a little inventory of yourself and then bring others in the faith community alongside you. So there's that. I think having an organization that prioritizes that is really important. One thing that's been really important for me is adding on to what Luke says about recognizing that it's God's work, not our work. Having the humility to recognize your own boundaries as an inherent part of how God made you. He did not make us to be able to do everything, and he did not make us to be able to function 24/7, 7 days a week. He built in rhythms of rest for us. And so not obeying those is kind of a pride that we have to think that we don't need it. And in instances where you're working in places where there's so much to do, I always like to quote one of the founders of Compassion International, who said that you shouldn't do, but you should influence. So no single organization can do everything, no person can do everything, but you can connect people to other organizations that are doing different work and be able to influence their lives. When it comes to prioritizing yourself, definitely take time off, really disconnect from your work on the weekends. Like Lou says, when work is over, work is over. Ruth Haley Barton, who's kind of one of the bigger leaders of the silence and solitude movement, said, if you don't come apart for a while, you will come apart after a while. And so I always carry that advice with me. And then lastly, keeping up spiritual rhythms. If you're working at an organization that has a lot of international travel or just travel domestically, it can be really, really hard to keep up with habits of prayer, silence, solitude, celebration, fasting, those sort of things. So finding ways to integrate that into places, no matter what time zone you're in, you can do that is really important. And I really like the resources shared by the Soul Care Collective. They're an organization that helps people involved in ministry, both pastors as well as parachurch ministries. And they do a silent retreat every first Saturday of the month. So that's something that you can either get the study guide and do on your own time, or do as a part of the collective.
Thank you, Yasmine. I want to echo how special it is to work for a faith-based organization. It really does bring so much to be able to reflect with your coworkers and be spiritually grounded. It's just so special. And I also want to echo the humility to recognize our own boundaries. Like you said, we have to practice self-care and really remember that the work can only get done if you are your whole self and you take care of yourself and remember that really to prioritize yourself. So I appreciate that a lot. Thank you, Yasmine. And Tom, what wisdom can you share with us about maintaining spiritual balance over a longer career?
Thanks. So many wise words that we've already heard here, just amazing. I believe to say spiritually grounded, it's important to find a passion or calling that's grounded in scripture or revelation, or better yet, let it find you. I do that from like reading scripture, praying. I sing in our church choir. I try to stay open to the word of God, to both me personally and to us more corporately. And then pay attention. I think this came up a bit earlier about how it affects you. But I do recommend you hold that passion or calling lightly, since opportunities to engage on other issues and causes that may seem kind of off mission will come up. And I think for a lot of you who might, if you did lose your job this past year because of the cuts, this might be where you're at right now. But you can also contribute. Those things can contribute to your ability to add value later, even, and in what you're doing, of course, but also maybe later. I was moved very early in my career after reading Isaiah 65, especially the part 17 to 25, where it says, never again will there be an infant who lives but a few days. And I was especially moved when I realized this was talking about a future state on earth, not in heaven. People are dying, but after they're 100. And that drove me to make child survival the center of my work. I've added value in other areas like human rights when I was in the Dominican Republic. child dental health in North Carolina, early child education and child protection in Tanzania and Ghana, and even like reducing honeybee population loss in the US. But my core commitment has really been in child survival, and it's partly because of those promises and because I've been able to see what God's doing, where we went from 60 million children dying every year down to below 15. And I'll actually be preaching on those verses from Isaiah at my wife's church here in Spain, and it's coming up on the 16th of November in the lectionary. So it just, that has already really has grabbed me, but doing other things. Like at one point I was having trouble finding any work. I took a local hospital job. I was doing quality improvement. Oh my gosh, how that helped me later in jobs with NGOs and development organizations. At the time, I really didn't enjoy it that much, but I learned a ton. And I really saw that this was God's plan for me at the time, to develop these other skills that I could then use for that primary calling. Thanks.
Thank you, Tom. It is really nice to hear you reflect on how scripture led you to focus on child health, and hearing the amazing work that you've done. It's so inspiring. Thank you. And as we close our prepared questions, we want to leave our young professionals with encouragement for the journey ahead. Each of you have walked a unique path, and your wisdom has been and will be such a gift to everyone that's listening here today. So, our last question is, what is one piece of wisdom or encouragement you would offer to students and young professionals as they seek to build meaningful, purpose driven careers? So, Dr. Asin, we are going to start with you. What is one piece of wisdom you'd want to share with the next generation?
Thank you so much, Angelica. And I realized I didn't answer the previous question about staying grounded, because I also stay grounded spiritually. But yeah, I think I really agree with the insights that were shared. And one of the things I also wanted to mention in that particular question is always okay. Also, that aspect of gratitude, because remember, you're not the savior, you're a steward. Like Lucas said, you do your work faithful and diligently and leave the rest to God, because sometimes in global health, the outcome can really be, uncontrollable. You cannot be able to control that outcome. So just appreciate the little that you've done, the little small act of service that you've done, and of course, surrounding yourself with the community that really, you pray together, keeps you grounded, reminds you of your purpose and not really your performance all the time, because mental health at the end of the day is really, really important. Cool off and always look at the positivity and appreciate the little that you've done. I think one of the advice I will just want to leave as we conclude to the young professionals is that I'm going to bring out the three P's, capital P. So let you be driven by your purpose and your passion in whatever you do, and not the positions. Many times when people go to global health, they're chasing the titles, the roles, and you're forgetting actually at the end of the day what is expected from you. How useful can you be in that particular area that you've been planted? And also, as you, of course, build on partnerships, let us listen and also be respectful to the other experiences that I've shared, because communities are different. I think we've seen that some challenges can be experienced in one community that you've never experienced. So be open to learning also those other challenges and appreciating the challenges, so that we collaborate and come together to come up with really solutions that will address this community. So I think let you be driven by the purpose and your passion rather than the positions in global health. So I think that's one of the advices I wanted to give.
Thank you so much, and I apologize for skipping over you in the previous question. I want to echo being open to learning, and I really appreciate what you said about appreciating the challenges. I think that is an incredible perspective to have. Thank you so much. Yasmine, what encouragement would you give to someone just beginning?
Yeah, so I guess I would say that there have been a lot of massive cutbacks in large organizations. But what I've seen throughout the past few months is that there are a lot of small and medium-sized organizations that are still chugging along. I think most recently I described it like Pearl Harbor. Sure, some of the bigger battleships have been sunk, and it's a major tragedy, but we still have a fleet, and we are going to be able to come back from this. I attended the Accord Network pre-conference for global health last week, and they had some guests there who worked in the for-profit sector doing WASH work, so obviously very connected to humanitarian organizations. And they said, this is something that the corporate world goes through pretty often. And so while things are different and tenuous, they are not going to be that way forever. Our field has largely been shielded from the major layoffs and volatility that the market in a capitalist world experiences. But this is actually a pretty normal experience. So things are different, but they're not always going to be different. And I think the most important thing I could say is that public health still matters. Global health still matters. So what you have studied, what you have learned, what you are passionate about still matters to the world.
Thank you, Yasmine. I agree that we have so much to look forward to, and there's so much to learn from these changes, from each other, from the field. Thank you so much. Luke, what final piece of advice do you think is most important?
I think I would say hold your work quite lightly. Aim for something that you love. But when we look through the Bible, those stories that we remember, they're really exciting. But usually that person has a big piece of history that we don't know much about. And probably in that time, they were training, they were practicing, they were getting it wrong, they weren't seen. Some of the most formative part of my short career so far have been in much more junior roles or things that aren't that glamorous, but have been really helpful. So yeah, don't chase the title. It's very easy to do. I won't speak for the others. I have done it. It's what we do naturally. But the place that we're most effective is where God's put you right now. If he wants to put you somewhere else, he's going to. But he doesn't judge us by standing. He judges us by faithfulness, in my perspective. So, yeah, that'd be me.
Thank you, Luke. I agree to focus on the experience and, like you said, where God has placed you now. I always tell myself, everything is part of the journey. And, it's interesting because I feel like everything eventually makes sense. You'll reflect on the past 10 years and it just seems to work out so perfectly. And so, very grateful for that. Thank you. And Tom, what encouragement would you offer as young professionals seek to build these purpose-driven careers?
Well, I want to talk about someone who's extremely important in all this often and doesn't get a lot of the credit. If you're in a long-term relationship, plan to balance your work focus with your spouse or partner. Most likely, sometimes he or she will work full-time and sometimes you will. It's a long life. My wife, Judy, and I have taken turns in that way. For example, she was working as a physical therapist while I was going to public health school. And then I was working in global health while she was getting her master's in public health. And then I worked full time while she was getting her divinity degree and a doctorate, and we were in Geneva. And then now I'm consulting part time in Spain while she works full time pastoring a church here. So we pretty much have both gotten our dream jobs at different times in our career, but not at the same time. And remember, if you have a good work life, but you have lousy friend and spousal relationships, you're probably not doing it right. You'll struggle also to cut back on work as you approach retirement because you may have little else that gives your life a lot of meaning and joy. So I think it's important to plan together if you have a significant other or someone, even really close friends. Consider their needs, consider what do you need to have that social network as well so that you can both be fulfilled. I think that's really important. Also, we talked a little bit about burnout, just doing what's needed to avoid burnout, get out of those toxic places and work relationships when it's clear that things won't change. I was in a position where I had a wonderful title and I stayed in it too long and I started getting burned out not that long ago. And another thing, consider being a digital nomad in a country that has a lower cost of living that allows you to stay healthier and to work virtually. Spain, Malta, Portugal, Greece, Thailand, Mexico, all of these are pretty good. In Europe, we get about 4 weeks of vacations, usually the minimum. You get 5 when you turn 50. Healthcare is ranked very high in some of these countries. I pay about $100 a month for full healthcare, no deductibles or copays. Some of those other things, I think, not having them and not having the time to rest really could just wear you down. And I frankly don't think the US is really a healthy and safe place for working and raising a family. And I've been much healthier since I left there in 2018. So if you are in a country where there's just a bad culture of making people work too hard, and even having those huge inequalities just rips at you over time, consider other things. You wouldn't believe how much easier it is than you think probably to, put down stakes in a new place. Thanks.
Thank you, Tom. I feel like we've all heard that in our relationships, it can't always be 50-50. Sometimes it's 80-20. So it's really nice to hear that from you. And also want to echo making time to rest, like you said. And I'm glad that your lifestyle is much more manageable than it was in the United States. That's actually very encouraging. So thank you. Perfect. Thank you all so much for sharing such thoughtful encouragement. I know our audience has also been reflecting on their own journeys, so now we'd like to hear from all of you. We'll spend the next 10 minutes in Q&A, so please feel free to type your questions into the chat box, and we will bring in as many as we can. So we also encourage you to unmute if you would like as well to ask your question. We'll give it a minute.
Angelica, there is one in the chat.
Oh, perfect. All right, from Catherine, in terms of furthering education, is a Master of Public Health translatable to the global health sector, or would you recommend focusing on a Master in Global Health? Does anyone want to chime in?
I can jump in quickly on that. Others might have other experiences since I have a master's in public health rather than global health. I do found like the master's in public health definitely included some people who were planning to just focus domestically. For me, it was in the US, along with people that wanted to do work in global health. I found that actually useful. And for parts of my career, like I took a hospital job, I was a senior director of continuous quality improvement. That was something public health really helped me with. Some statistics, some things about health promotion, behavior change, really useful. I think behavior change itself, it's gaining a lot of ground. And so there are a lot of organizations that would probably want that sort of background. It can be pulled into marketing a bit as well. So I found that definitely very translatable to global health. And maybe someone who had more of a focus on the master's in global health can say, how do you feel about that?
Thank you, Tom. I agree. Like Luke, I also started with my Bachelor of Social Work and I'm almost done with my Master of Public Health. I graduate in July, and a lot of it is interconnected. A lot of it's really even the systems that we learn, everything just is layered on top of each other, basically. So I feel like at the end of the day, it seems to focus, or the most important thing is your experience and what you gain from volunteering, interning, working. That will, at the end of the day, make the biggest difference. Does anyone else want to chime in on Catherine's question? Of course, Luke, feel free.
Sure, thanks. So, to caveat, I did not do a public health degree, but if you are before you start working is the easiest time to do a degree. So, if you are not currently working and you can afford it, it's a good time to do it. When you are in work, it's much harder to step out of it. So, if you're umming and ahhing, and financially you can, whether you're in the States or wherever you are based, it's helpful because having a master's just allows you to think that little bit more deeply and to see some of the research, whatever the subject. So that's helpful. If you are further in Korea, then depending on your location, there are often ways of getting like post qualifications in specific areas. And I think at that point, so for me, if I was to do more study, it would be on something really specific. But 10 years ago, I wouldn't have minded. It could have been a lot more broad. So that's my take. The caveat being that I've not done a public health degree.
Thank you, Luke. It's true. Learning is continuous. It never ends. You will never ever stop. For example, we just had our virtual learning institute, and that was such a great opportunity to learn about maternal mental health and focusing on those opportunities, really taking everything that you possibly can. It allows you to really have such a multifaceted worldview and perspective that you can apply to your job. So I appreciate that. Just take advantage of every opportunity you possibly can. Yasmine, do you want to add? I see a link in the chat.
Yeah, I just put a link to the Soul Care Collective, which has a lot of resources for preventing burnout and taking care of yourself. Yeah, I guess I can add a little bit to the conversation. I think it comes back to what we said earlier. It's not about the title, it's about the quality of the work that you do. So I think when it comes to whether you want to do an MPH or do a Master's of Science in Global Health, I think it comes down to what's the curriculum that you're going to be doing, what's the accreditation of the university, and what are the opportunities that they offer for their students. So really more about what kind of education you're going to get, because whether you learn about global health or learn about public health, more domestically, there is a lot of translation between the two.
Thank you, Yasmine. Dr. Asin, do you want to add anything? I know.
Yeah, I think most has been said, but I really resonate with what Luke was saying, also coming from a point where I don't have my master's in global health. But I think the studying helps you to broaden your knowledge. But I have a feeling that you're going to like get more experience practically, actually, when you start working and building up on the experiences that you have. And also tying back to what Yasmine has said, as you're deciding on what course you want to do, you look at probably the modules that are being offered to see whether it resonates with what you want to do in future. But yeah.
Thank you. Perfect. So we have about 4 minutes left of Q&A. So I will jump over to Emmanuel's. So he says that he is working as a laboratory scientist at the National Public Health and Reference Laboratory of Ghana. And despite his work in public health laboratory, he wants to dive deeper into the public health profession. He's asking what advice and guidance would anyone have for him? Possibly Tom, would you like to?
Sorry, I was thinking it was in the chat. I didn't see it. Could you repeat that question?
Oh, so it's from Emmanuel. So he's asking, pretty similar to our previous question, how to transition from being a laboratory scientist and diving deeper into the public health profession. So mainly it sounds like that transition phase.
Yeah, well, I think, I don't know if you have a public health degree or not, but I think that definitely can help getting those essentials and things like epidemiology, behavior change, a little bit of MCH, that it's just much easier. And the nice thing is, if you already have an MD or a lot of medical background, it's sometimes a 1-year program instead of a 2-year program. And I think talking with people in Ghana that are in public health, it's probably the best way to find out what are your resources locally. And sometimes knowing some people who are doing outstanding work there, they might be your mentor as well to help you know how to move forward in that path. And that's what I would recommend.
Thank you, Tom. I see, Emmanuel, you've raised your hand. Do you want to unmute?
Yes, I wanted to add something to your question.
Oh, I'm sorry, can you repeat that, please?
Like a follow-up to the question.
Cannot hear Emmanuel that well, but thank you so much for your question. Let's see. So we have a couple of minutes left. Oh, I'm so sorry. And I do see Mona suggesting to join membership associations such as CCIH. Absolutely. And attending conferences as a young professional to help connect. Thank you, Mona. All right. So does anyone have any, oh, Yasmine, online courses? Yeah, I love LinkedIn Learning. That is absolutely, even just having it on your LinkedIn page, I feel is so valuable. Oh, yes, Tom.
Yeah, I would say in addition to that, if you see opportunities for courses, there are a lot of things that when I was there, I think they're still happening. It's like, are you learning like positive deviance hearth, barrier analysis, how to use care groups? I'm trying to think of some more common ones now, but those things often, if they're more recent, some of the more recent things in particular, you might not have them in your classes. And so that's where, if you can get involved with some of those trainings, which I know CCIH has done in the past, core group has done them in the past, that's important. Because, or even like how to do a KPC survey. It's one of the main things I needed when I started doing consulting, where all the jobs were. And it's like, we didn't have that when I was going through school. We did have a whole quantitative focus you could take, and that would have helped. But this was something you could do a 4 or 5 day course, get certified, and immediately start using the skills. And I'll put a couple other in the chat when I remember the thing.
Thank you, Tom. Oh, Judy, yes, please.
Yes, I have something for Emmanuel, and I think we have always been singing networking, and I want to network with him and connect him to other partners in Ghana, because I have an idea how he can be able to, venture more into the public health, and especially this side of AMR and One Health discussions. We have partners in Ghana whereby it's multi-sectoral, so having that joint engagement also with the environment and animal health sectors coming together to do data interpretation and surveillance together, joint development of policies. So those are some of the things maybe he can delve further into if he's interested, and more community engagement. And if he feels like that is a space where he can be able to dive in and meet with the other, lab experts within those particular sectors, we can connect. I connect him to other people from Ghana. Yeah.
That is amazing, and it warms my CCIH heart. So thank you so much. So, Tom, I did see one question if you want to take a few minutes to reply to, but what was the process like for you moving from the US to Spain? That's my cat, by the way.
Yeah, actually, I moved from the US to Geneva, Switzerland with World Vision International. And then I moved to Spain, but still, it was the same as if I was coming from the US in a way. So there are a lot of online you can find. If you look like for Move to Spain or Digital Nomad, there are tons of videos that kind of go through what you need. Like for me, I needed to have one contract for 1 year with a minimum, I think it was $3,600 a month. So it wasn't even a big contract. And then after that, I have a visa for 3 years. And now they've loosened it where you can have multiple clients to help put together that amount of money. And even if you have some other passive income of some sort, you could use that to make it. And then after that, they're just like things like a certified marriage certificate if you're coming with your spouse, or a complete copy of your passport. So a lot of kind of administrative things. But the main thing was, at least coming from the US, was having an employer that says, we will pay this person for a year living in Spain. And I did it as a consultant. So I was kind of surprised it was easier to do.
Thank you so much. That is so inspiring. And it's amazing the strength it takes to take that leap of faith, the bravery. So thank you so much for sharing that.
Yeah, and after we decided to do this, my wife was offered a job at an English-speaking church here in Spain. It just, everything came together, let me tell you. So God was definitely in the
Thank
works.
God. That's refreshing to hear. Thank you. I know we have less than 10 minutes left, so as we wrap up, I'd like to move us into a short time of closing and reflection. This is also a good time to remind you that CCIH will be gathering in person from April 21st to the 23rd in the Philippines. Yeah. And we would love to see you there, especially to all of our members and anyone in Southeast Asia. And on behalf of CCIH, thank you again to each of our panelists and to everyone who joined us today. We hope you leave encouraged and inspired in your career journey. And we also would love to hear what you thought about the webinar today. We are going to put a link in the chat box for you to answer just one question, just one question. So please, that would be so appreciated. But overall, this concludes today's webinar. Tom, would you be open to leading us in prayer?